Now, in other news, the Health Workers Union now says that some insurance companies are becoming a major impediment to quality healthcare access, particularly at the Nairobi hospital, which has been rocked by leadership wrangles. Now, as Elizabeth Atieno reports, the standoff has seen several insurers suspend services, putting patients at risk.
Nairobi Hospital, Kenya's leading private healthcare institution, is facing a turmoil fueled by changes in the management, disputes within the boardroom, and the withdrawal of coverage by more than 10 top insurance companies over a contested rate review. On the 15th of August 2025, the Nairobi Hospital announced that it had suspended the recent price adjustments after consultations with the respective stakeholders. However, the hospital maintained that it will increase the cost of some medications by at least 5% due to the increasing cost of importation. In the planned price review, some charges were expected to rise up to 61%, with inpatient, outpatient care, diagnostic, surgeries, and specialized treatment rising by as much as 5,000 Kenya shillings. The ongoing crisis at the facility has left hundreds of patients stranded, and now Health Workers Union have accused some insurance companies of working together to fleece and interfere with the management of patients by some doctors, further curtailing health service delivery between doctors and patients at the Nairobi hospital.
The biggest impediment to universal healthcare in this country are private insurance companies that have decided to get themselves into cocoon and dictate to the patients which hospitals to visit. They dictate to patients which doctors to see. They dictate to patients which lab tests to have. And they dictate to patients which drugs to be issued. This has become rampant.
Additionally, there are concerns that some of the insurance companies are increasing premiums, claiming that the cost of living is high, yet providers like Nairobi Hospital have been restricted to increase the charges.
Insurance companies must know this, that just the way they increase premiums on Kenyans and on the people that life has become expensive, so are the hospital owners. The drugs are more expensive. People are asking for pay rise. So when they ask to review the costs, the insurance companies cannot come together like cartels and then push back.
The health unionists have accused the Competition Authority of Kenya and the Insurance Regulatory Authority of abdicating their duties to protect the patients and the service providers.
Insurance companies must keep off the relationship of a doctor and a patient. Is a holy matrimony of two people whose details should be private.
The insurers that have suspended the services at the facility have cited disputes over billing practices, delayed reconciliations at the hospital's pricing structure, further requesting for independent audits of claims and a comprehensive review of service rates.
And now they have come with a new habit that when you go making claims on admitted, they tell you that you should first of all exhaust your SHA before you touch the insurance. SHA is a public fund that caters for the poor. So these rich private companies cannot then say that you want to impoverish SHA further before you start using your money.
The Nairobi Hospital, through its board chairman, Basley Onyambo, have maintained that they are willing to engage with the medical insurance firms to resolve the ongoing stalemate. Elizabeth Atieno, TV 47.